in the industry of sleep? What are kind of the growing problems? Let's just go ahead and dive in.
Oh, thank you, Lisa. And on top of all that, which you're so kind, you are my therapist, and we've been working through after having shoulder surgery recently to try to whip me back into shape, of which you're doing it at a level I've never seen before, of course.
Oh, well, thank you.
Um, I'm really excited about the subject of airway, breathing, and sleep because it's such a big topic. And I guess we could start by saying, you spend 7, 8 hours a night in bed,
Yep.
which adds up to about 1/3 of your life is spent
Mm.
in bed, hopefully mainly asleep. Uh,
Right.
but what we're seeing is changes over the last well, even recently, that are occurring in our culture
Mm,
where this issue is becoming bigger and bigger and bigger and bigger. All
mm,
of us have heard of sleep apnea, which is basically where you stop breathing maybe 10 or more seconds with your oxygen levels dropping 4, 5, 6% each episode. And we realize that that's become a big issue in our country with an estimated 30 to 40 million people suffering from sleep apnea. But
wow.
as I've been studying this subject very diligently since 2012, I've learned that sleep apnea is just the tip of the iceberg. It's not
Mm,
even the most common issue related to poor sleep and breathing. So I'll share with you a little bit about that. But what I've done as a dentist is I've tried to go find the top people in whatever field they're in to learn about these important topics and then ask the question, where do we fit in it, if at all? And as an
right.
educator, I want dentistry to be, just a very highly regarded specialty of medicine.
Yeah,
And of course, it's the portal to the whole body. And so
it
there's a
sure
lot going
is.
on there that often is overlooked in medicine. And breathing is part of that, whether it's through your nose or through your mouth.
Hmm.
So let me just give you a little background, and then you just ask me questions and stop me as we go along.
Okay.
There have been changes in the last, say, 200 years in the facial form of people in the West, meaning
Mm,
it's like our faces, the lower half of our faces are shrinking and going backwards. And so anthropologists who study history of human conditions have been studying this. And what they believe has happened, which is very interesting, is it goes back to the Industrial Revolution
mm.
when women would start moving out of the homes into factories and workplaces out of the home, it became less popular to breastfeed, more popular to bag feed, and eventually bottle feed. But with that, the babies, the newborns, are not using their muscles, particularly their tongues, like they are supposed to. And yet it's
Well, let me
super.
stop you for just a second. So I have a question. So in a case like that, and I'm thinking actually about my nephew, because
Mhm.
he has exactly what you're talking about, that forward jaw. And he ended up having, they told him, if you don't have the jaw surgery to correct your jaw,
Right.
you're going to have all sorts of problems when you get older. So he went in and had, so at what point do you correct with what you're talking about?
Okay.
And he was under 21 when
Yeah.
he had the surgery.
Right. Okay, so now you're getting into the treatment part. And let me come back to that.
Okay.
I promise I'll come back to it in just a
Okay.
couple of minutes, but
Okay.
I, I kind of want to follow this through. Um,
Okay. Go ahead.
so, so self-assessment. What can
Yes.
you do? What can any of us do today? Number
Right.
one is ask yourself, if I had a history of allergies, do I breathe through my mouth? Do I sleep well at night or do I wake up? Do I wake up rested? Do I
Mhm.
feel rested even at lunchtime? I see people all the time coming in their 60s, and you'll say, so how do you feel rested and energetic? And I'll say, no, I'm in my 60s. Like
Right. They
in your
always say
60s, you're
that.
supposed to feel really tired and
That's
fatigued,
right.
not sleep well and fall asleep in the car and after lunch. But that's
Right.
not true.
Right.
You can be energetic until you're in your 90s
Yeah.
if you're sleeping well and healthy. And so that's a misconception of our society that as you age, you should just kind of go straight downhill each year. But no, no, that's not true at all.
But I would think, to your point of how this all started, right, is
Yes.
if you have that surgery, yes, it corrects it, but does it start to, do you start to retract and have other problems because you
Yeah.
haven't fixed the problem?
That's possible. So
The
now,
breathing?
when you have a multifactorial approach to it, you're going to be thinking and analyzing it. Do you have allergies? Can you breathe through your nose? Do you have blockages, deviated septum, or
That's
turbinates
right.
that you can't breathe through your nose? So that might be something to address with the ENT.
Yeah.
Right. And then, so if those things are going on, then, or from food, whatever it might be, that you want to correct that, and then make these permanent corrections. And then we actually work with what are called oral myofunctional therapists. So
Yes, I'm
they're therapists that
familiar.
work with swallowing and breathing
The
and
tongue.
closing the mouth and breathing through the nose. So some people that have been chronically mouth breathing, it's hard to switch. I mean, it's an
Yeah.
ingrained habit. So will correct the problem, whether it's upper airway or posterior airway, structural airway. Will correct the tongue tie release is
Yep.
something that's being done a lot, even on newborns.
Hmm.
So all those things trying to open up the breathing, right? And then at night, if we're mouth breathing, then things like tape can be great.
Well, and what you and I have talked about is there's nobody really doing this. I mean,
Not much.
the sleep doctors are really just don't want to deal with this part of it. They just do,
Yeah.
the sleep apnea. So unless you find somebody like me who's interested or who could address some of these things, nobody's talking about this.
Yeah, I know. And we're fighting, to try to make this something that's well known. We may have to go to the public to do it. There's a change going on in the country. It's a group of moms that started what is called Make America Healthy Again. I know
Yeah.
it's kind of getting connected with the administration, but really it was started by moms all over the country on like what are the kids being fed in school,
Oh,
that
yeah,
making them
sure.
sick. And so that's a whole nother subject that directly relates to everything we're talking about as
Yeah.
far as inflammation. And so we're trying, I teach around the country in dentistry, but we're trying to connect with our medical colleagues too
Yeah.
and develop links with people that are really sharp that can then talk about this. There are two good books I would recommend to you. I don't know if I have them
Okay.
right here. I might have them right here.
Good energy, is that one?
Yes. I don't have them right here, but
Great
you
book.
you can talk about this on other times you're all together. But good energy, good energy, yes.
Awesome.
By Casey Means came
Yep.
last May, and in that book, she spends a couple chapters on sleep, airway, breathing, and how important it is.
Yeah.
And then Peter Attia, who's on the
Yep.
East Coast, he wrote a book called Outlive, and
Outlive,
it's
also
also a
very good.
very current, sharp book. And he spends quite a bit of time on sleep. So those books are great information sources on this. But we have to get past just CPAP. That's the
Yeah.
trick is that
Yeah.
CPAP is not I'm in no way critical of CPAP. It's just that the compliance is so poor. So this isn't about, sleep physicians aren't good at all. It's just we have to have more than one solution for the problem in order to, really address the majority of people because so many people are CPAP intolerant or just don't get that far in their workup. So some of these little, I call them biohacks, like paper tape, and you can buy over-the-counter oral appliances just to try things out. Do the sleep lab, snore lab, and see what's going on there with a good reflection of airway being open or blocked. These are all things that can be done, but also that high resolution pulse oximeter gives you a real good idea. Super inexpensive, very easy to do, just a
Right.
screening tool. So we'll work on that together. That is something maybe
Yeah.
you all can do.